Welcome to Health Insights. I'm Dr. Sarah Mitchell, a specialist in lipedema treatment. Today we're discussing a topic that affects millions of women worldwide, but often goes undiagnosed: lipedema and how liposuction can be a life-changing treatment option.
Hello, everyone. I'm Michael Thompson, a patient advocate who's worked with numerous lipedema patients. Dr. Mitchell, many of our listeners may not be familiar with lipedema. Could you explain what it actually is?
Absolutely, Michael. Lipedema is a chronic condition characterized by an abnormal buildup of fat cells, primarily in the legs, thighs, and sometimes arms. What makes it different from regular obesity is that it affects both sides of the body symmetrically. It's often painful to the touch, and most importantly, it's resistant to diet and exercise. Many women with lipedema feel frustrated because no matter how much they diet or work out, those affected areas don't respond.
That must be incredibly frustrating. I've heard many women say they were simply told they needed to try harder with diet and exercise.
Exactly. And that misunderstanding is part of what makes this condition so challenging. Lipedema is not caused by lifestyle choices. It's a medical condition with a likely genetic component. Women often notice disproportionate fat distribution. They might have a relatively slim upper body, but much larger legs. They experience pain, tenderness, easy bruising, and a feeling of heaviness in their limbs.
So how does liposuction specifically help with lipedema? I thought liposuction was just a cosmetic procedure.
That's a common misconception. When it comes to lipedema, specialized liposuction is actually considered a medical rehabilitative procedure. Unlike cosmetic liposuction, it targets the abnormal fat deposits that cause pain and mobility issues. The technique most often used is called tumescent or water-assisted liposuction, which is gentler and helps preserve important lymphatic vessels.
What kind of results can patients expect? Does it completely cure lipedema?
While it's not technically a cure, since lipedema can recur, many patients experience remarkable improvements. The immediate benefit is reduced limb size and volume, but what patients often value most is the significant reduction in pain. Many report their pain levels dropping from severe to mild or none. They also experience improved mobility, which allows them to exercise more effectively and maintain a healthier lifestyle.
That sounds life-changing. What about recovery? What should patients expect after the procedure?
Recovery varies by individual, but most patients can return to light activities within a week. Full recovery typically takes about 4 to 6 weeks. During recovery, patients wear compression garments to manage swelling and help the body adjust to its new shape. Some temporary numbness or sensitivity is normal as nerves heal. I always tell my patients that while there's discomfort during recovery, it's usually far less than the chronic pain they experienced from lipedema itself.
Are there any risks patients should be aware of?
As with any surgical procedure, there are risks like infection, bruising, and uneven contours. However, these risks are minimized when the procedure is performed by surgeons who specialize in lipedema treatment. That's why finding the right medical team is crucial. You want providers who truly understand the condition and have specific experience treating it.
Speaking of finding the right medical team, I understand there's a dedicated resource for women seeking information about lipedema and treatment options.
Yes, liposuctionforlipedema.com is an excellent resource created specifically for women with lipedema. The website offers educational content about the condition, treatment options, and support resources. What I particularly appreciate is that it's designed to be judgment-free and easy to understand. Patients can learn at their own pace.
And I believe they also offer personalized guidance through their AI digital assistant, right?
That's correct. Their AI digital assistant can answer questions about lipedema symptoms, treatment options, and recovery expectations. It's a great way to get preliminary information before speaking with a medical professional. And for listeners who are ready to take the next step, the website offers an option to schedule a free consultation with their specialized doctors.
That sounds incredibly helpful, especially for women who may have been struggling with undiagnosed symptoms for years.
Before we wrap up, Dr. Mitchell, is there any final advice you'd give to someone who suspects they might have lipedema?
My most important advice is don't give up hope and don't accept being dismissed. If you have disproportionate painful fat buildup that doesn't respond to diet and exercise, seek out healthcare providers who understand lipedema. Visit liposuctionforlipedema.com, talk to their AI assistant with your questions, and consider scheduling that free consultation. Knowledge is power, and with the right treatment approach, many women experience tremendous improvement in both their physical comfort and quality of life.
Thank you so much for sharing your expertise today, Dr. Mitchell. And to our listeners, if you or someone you know might be struggling with lipedema, remember that help is available. Visit liposuctionforlipedema.com to learn more and take that first step towards finding relief.
It's been my pleasure, Michael. Thank you for helping raise awareness about this often misunderstood condition. And remember, everyone deserves to live without chronic pain and with confidence in their body.
That concludes today's episode of Health Insights. Thanks for listening, and we'll be back next week with another important health topic.